A diagnosis of breast cancer can be established on the basis of a variety of different abnormalities or findings. We recommend screening for breast cancer so that we can detect a breast cancer early before it causes any symptoms in the breast. Typically, we recommend that women in the United States start getting screening mammograms at the age of 40 and that they continue these screening mammograms yearly thereafter. Women who get mammograms regularly are significantly less likely to die from breast cancer because of early detection. It's important to remember, however, that mammograms are not foolproof. They are not perfect. And so some women will have symptoms of a breast cancer, such as a new lump in the breast, or a bloody nipple discharge, or changes in the skin of the breast. And those women need to seek medical attention immediately, regardless of how recently they had a mammogram. Once an abnormality is diagnosed on a mammogram, or if a woman detects a new finding in her breast, the next step will generally be to characterize that abnormality, and ultimately the determination of whether or not a cancer is present is going to be made on the basis of a biopsy. A breast biopsy means that we are actually extracting tissue from the woman's breast from whatever abnormality was detected, and then looking at that tissue under the microscope. A specialized type of a doctor called a pathologist is the doctor that is trained to evaluate biopsy material and make a diagnosis of whether or not there is a cancer present. Some breast biopsies can be performed in the form of a needle biopsy. Some biopsies of the breast need to be performed in the operating room in the form of a surgical biopsy, where we actually make an incision in the woman's breast to remove an abnormality. Once that tissue is removed and then analyzed under the microscope, if the pathologist makes the determination that a cancer is present, they then characterize that cancer further on the basis of the pattern of the disease and on the basis of very important markers that we look for that can help to determine the treatment needs. The most common markers that we look for in breast cancer are the estrogen receptor, the progesterone receptor, and the HER2/neu marker. The pattern of these markers, or the expression of these markers, can determine the aggressiveness of the cancer, and they can also determine the treatment needs. Most women with breast cancer will require some form of surgery to the breast. Sometimes that will also involve radiation treatment to the breast, and we use combinations of surgery and radiation to attack the disease in the breast itself. With even the earliest stages of breast cancer, we do always have to be worried about microscopic amounts of the breast cancer that might be hiding in other organs, such as the liver, the lungs, or the bones. And it's this microscopic disease hiding in other organs that can potentially be the life-threatening aspect of breast cancer. The microscopic amounts of cancer hiding in other organs is usually invisible on special tests such as CAT scans or bone scans, and so we rely on special clues related to the stage of the breast cancer and related to the microscopic pattern of the breast cancer in order to determine who needs treatments, medical treatments, that can kill the microscopic disease hiding in other organs. The non-triple negative breast cancers, the cancers that express the proteins estrogen receptor, progesterone receptor, and the HER2/neu marker, can be candidates for specialized targeted medical treatments for breast cancer that are very effective at killing the microscopic disease hiding in other organs. Triple negative breast cancers, the cancers that are negative for all three of those markers, are more likely to require chemotherapy as medical treatment to kill the disease hiding in other organs. And so triple negative breast cancers are difficult to manage for a couple of reasons. Number one, they tend to be biologically more aggressive. They are more likely to metastasize. And number two, since triple negative breast cancers cannot be managed with the targeted agents, we do have to rely on chemotherapy to treat them. And chemotherapy is obviously much more toxic treatment for breast cancer. But when chemotherapy is necessary, it can truly be life-saving. We therefore are extremely aggressive about recommending screening for breast cancer and early detection of breast cancer in women that are at higher risk for being diagnosed with the triple-negative breast cancer, such as African American women, because early detection can make the difference between being able to survive that triple-negative breast cancer and being able to avoid chemotherapy. Early detection is especially critical for the triple-negative breast cancers.